Hello guys, welcome to the whiteboard talk. In this lecture, we will be learning about MPGN, that is Membranoproliferative Glomerulonephritis. So Membranoproliferative Glomerulonephritis, it is also called as mesangiocapillary glomerulonephritis. Mesangiocapillary glomerulonephritis. So this is the basic other name of the MPGN. MPGN is nothing but it's a pattern of the immune mediated injury. This is a pattern of immune mediated injury. There is nothing special about it. It's just an immune mediated injury. So we basically have two types. We can divide MPGN into type 1 and type 2. Type 2 is also called as dense deposit disease. Dense deposit disease. And type 1 is mainly due to deposition of the immune complexes. Type 1 is due to deposition of immune complexes containing IgG class as well as complement-3 proteins. So type 1 is due to deposition of the immune complexes containing IgG and complement-3. That's why this is also known as complement-3 glomerulopathies. Complement-3 glomerulopathies. What is the basic pathology that happens in MPGN? Look at the pathology. So basically there will be accumulation of immune complexes in the mesangial matrix. We can see accumulation of immune complexes, and these immune complexes, as we just told you, they are nothing but IgG along with complement-3 proteins, and they'll go and deposit in the mesangial matrix. So this is the basic pathology that is happening in the MPGN. This results in proliferation of the glomerular cells leading to leukocytic infiltration, and this leads to activation of both classical as well as the alternate pathways. This leads to activation of both the classical and alternate pathways that we have in the complement system. Another pathway is the mannose lectin binding pathway that does not occur. So this is the basic pathology. Ultimately what happens, this leads to double counter, or we can say tram-track appearance of the basement membrane. So basically this is nothing but as a duplication of basement membrane that we'll see on biopsy. Duplication of the basement membrane. We can see two different types of deposits. In type 1 we will see subendothelial deposits, but subepithelial are also present. So subepithelial deposit can also be present in the MPGN type 1. Moving on to the clinical features that we can see in MPGN type 1. Clinical features are the same as the nephrotic syndrome. Same symptoms like that of a nephrotic syndrome, that is then proteinuria, hyperlipidemia, and then the edema and everything. People suffering from MPGN, very few remissions occur. So remission rate is very low in MPGN. Most of them, some progress to RPGN, that is the rapidly progressive glomerulonephritis, and eventually 50% of the patients will progress towards renal failure in 10 years. So this is the ultimate outcome of people suffering from MPGN. Let's see the causes of secondary MPGN. Causes of secondary MPGN. So primary we have just discussed, this is due to immune complex deposition. Secondary, how it will occur? We have chronic immune complex disorders, example SLE. Chronic immune complex disorders. So those autoimmune disorders which we know immune complexes, example SLE, they can secondarily affect the kidney resulting into MPGN. Then we have patients suffering from hepatitis B, hepatitis C, as well as HIV. Then patients suffering from cryoglobulinemia, as well as patients suffering from infective endocarditis, patients suffering from infected ventriculoatrial shunts, patients suffering from chronic visceral abscesses, If you are finding this boring, you can just skip ahead for the type 2 MPGN. Patients suffering from schistosomiasis will also have schistosomiasis, can also secondarily involve the kidney leading into MPGN. Patients suffering from alpha-1 antitrypsin deficiency, patients suffering from CLL, that is the chronic lymphoid leukemia, that is the lymphoid malignancy. So these are all the secondary causes that can lead to MPGN. Kindly have a look at it once. After this, we are moving on to type 2 MPGN, also known as a dense deposit disease. So type 2 MPGN, which is also known as a dense deposit disease. Okay, in this what happens, there will be excessive activation of the alternate complement pathway. So there will be excessive activation of alternate complement pathway. This is all you need to know. Excessive activation of alternate complement pathway, and 70% of the cases suffering from type 2 MPGN, that is the dense deposit disease, will have an autoantibody termed as C3 nephritic factor. In short, we can write it as C3NEF. So 70% of the cases will have an autoantibody termed C3 nephritic factor, that is C3NEF. This leads to persistent complement 3 activation. Ultimately leading to hypocomplementemia. So there will be reduced levels of complement levels in the serum. This leads to decreased levels of serum complement 3 with normal C1 and C4 as well as IgG. So the patient will have isolated decrease in the complement 3 proteins in the serum. This is the basic pathology in the type 2 MPGN. What happens, this complement 3 will go and deposit itself. So we can see C3 deposits on the basement membrane and on either side of the basement membrane. This can result into subendothelial deposits as well as subepithelial deposits. So either side of the basement membrane they can go and deposit, leading to these deposits, or even they can go and deposit in the mesangium, leading into mesangial matrix deposition as well. So anything can be involved. The symptoms of the patient suffering from MPGN type 2, that is the dense disease, symptoms will actually vary between the nephritic syndrome features, can alternate with nephritic syndrome and nephrotic syndrome features. Nothing. The basic difference will be hematuria with hypertension. That's it. Around 50% of the patients with type 2 MPGN or dense deposit disease, they will progress towards end stage renal disease, ultimately requiring the need for dialysis, and 90% recurrence rate is there for MPGN type 2 even after transplant. 90% recurrence rate even after transplant. So this is the end outcome of patients suffering from type 2 MPGN. Thank you guys. Thank you for watching this lecture. If you liked it, make sure to share it to your other friends who might find it helpful. Thank you for watching.